Assalamualaikum. My name is Janatun Nurmi. My wearing ID is 1812900. First of all, I would like to express my gratitude towards our honorable faculty Nazneen Ahmeda Sultana ma'am for giving me this opportunity to say something in this platform. Today my presentation topic name is metabolism of levodopa. Now give a short description about this topic. Introduction. Levodopa is a prodrug of dopamine that is administered to patients with Parkinson's due to its ability to cross the blood-brain barrier. Levodopa can be metabolized to dopamine on either side of the blood-brain barrier, and so it is generally administered with a dopa decarboxylase inhibitor like carbidopa to prevent metabolism until after it has crossed the blood-brain barrier. Once past the blood-brain barrier, levodopa is metabolized to dopamine and supplements the low endogenous level of dopamine to treat symptoms of Parkinson's. The first developed drug product that was approved by the FDA was a levodopa and carbidopa combined product called Synmed that was approved on 2nd May 1975. The type of levodopa is a small molecule. The synonyms of levodopa is L-dopa, dihydroxy L-phenylamine. Indication. Levodopa on its own is formulated as an oral inhalation powder indicated for intermittent treatment of episodes in Parkinson's patients who are already being treated with carbidopa and levodopa. Levodopa is most commonly formulated as an oral tablet with a peripheral dopa decarboxylase inhibitor indicated for treatment of Parkinson's disease. Pharmacodynamics. Levodopa is able to cross the blood-brain barrier while dopamine is not. The addition of a peripheral dopa decarboxylase inhibitor prevents the conversion of levodopa to dopamine in the periphery so that more levodopa can reach the blood-brain barrier. Once past the blood-brain barrier, levodopa is converted to dopamine by aromatic L-amino acid decarboxylase. Mechanism of action. Levodopa by various routes crossed the blood-brain barrier is carboxylated to form dopamine. This supplemental dopamine performs the role the endogenous dopamine cannot due to a decrease of natural concentrations and stimulates dopaminergic receptors. Absorption. Orally inhaled levodopa reaches a peak concentration in 0.5 hours with a bioavailability that is 70% that of immediate release levodopa tablets with a peripheral dopa decarboxylase inhibitor like carbidopa or benserazide. Volume of distribution 168 liter for orally inhaled levodopa. Protein binding. Levodopa binding to plasma proteins is negligible. Metabolism. Levodopa is either converted to dopamine by aromatic L-amino acid decarboxylase or oxygen methylated to 3-O-methyl dopa by catechol O methyl transferase. Cannot be metabolized to dopamine. Route of elimination. After 48 hours, 0.17% of an orally administered dose is recovered in stool, 0.28% is exhaled, and 78.4% is recovered in urine. Half-life. 2.3 hours of daily inhaled levodopa. Oral levodopa has a half-life of 50 minutes, but when combined with a peripheral dopa decarboxylase inhibitor, the half-life is increased to 1.5 hours. Clearance. Intravenously administered levodopa is cleared at a rate of 14.2 ml kg in elderly patient and 23.4 ml younger patient. When given carbidopa, the clearance of levodopa was 5.8 ml in elderly patient and 9.3 ml in younger patient. Toxicity. There is no readily available data for the use of levodopa in pregnancy. Rabbits treated with levodopa and carbidopa produce smaller litters and they are developed visceral and skeletal deformities. Levodopa may lower prolactin and interfere with location, but there is limited human data to demonstrate this effect. After affected organism, humans and other mammals. That's all about my presentation. Thank you.